Platelet-rich plasma, or PRP, is blood that's been prepared in a way to extract the red blood cells and concentrate the platelets somewhere between about 2- and 5-fold. Platelets are little sticky cells in the blood that are involved in wound healing, and when the body is injured, the blood clots at that site and the platelets get stuck in the blood clot. And what we now know is that the platelets then release growth factors, and that these growth factors cause other stem cells to be attracted to the area, then differentiate into collagen producing cells, blood vessel producing cells, and skin producing cells, and then upregulate and start to heal the wound. So platelets are the cells that initiate and govern the wound healing process, and they're now used in many areas of medicine. Cosmetically or aesthetically, we can use them to rebuild and boost the skin by thickening up and improving the production of collagen and elastin fibers. There are many different systems for producing PRP now. Some of them produce PRP with a higher concentration of platelets and some with a lower concentration of platelets. It's still not clear exactly what the optimum concentration of platelets are, and so there is still work needing to be done with these types of systems. The systems that are around can be categorized as gel-based systems, which use a gel separator to separate the blood from the platelets from the red blood cells, or systems that use other ways of concentrating the platelets. It depends to a large degree on what the platelets are being used for, what part of the body, how much blood we need to take, as to what system is the best or most convenient to use. Platelet-rich plasma can then also be used in several different ways. It can be injected under the skin into the fat compartments in the face to boost the fat stem cells and create some revolumization of the fats. It can be injected into and under the skin to improve the quality of the skin itself, to improve the thickness and the elasticity and the luminescence, the reflectivity of the skin. And it can also be used in combination with other treatments and after lasers and needling treatments to boost wound healing, to improve the results and reduce the downtime. So it can be used in many ways aesthetically. The system that we'll be using this morning is called Regen Lab and comes from Switzerland. It uses special separating tubes that have a gel density separator. So the blood is taken just like at a blood test. It's then put into these special collecting tubes, which are then spun in a centrifuge for 5 minutes. It has a gel in there of an intermediate density between red blood cells and platelets. So what we're left with when we spin the tubes is the red blood cells as a pellet at the bottom of the tube, the gel density separator, and then the platelets on top of that in what's called the buffy coat. These can then be drawn up with the plasma and concentrated anywhere from about 2 to 5 times, depending on where we're using it and what results we're trying to achieve. Blood plasma treatments involve injections, and so there's always some needle prick pain with injections. The plasma itself has somewhat of a mild stinging effect sometimes, but its pain is not a major factor with PRP treatments. And we can use local anesthetic creams on the surface of the skin, as well as things like nitrous oxide or laughing gas and oral medications to help with discomfort during the procedure. There are several ways that we can use PRP. We can inject it underneath the skin with a syringe, and we might do that if we're trying to get it down into deeper fat compartments to reboost the fat volume down there. I've got also an injecting device or injecting gun, which enables me to inject the PRP into the surface of the skin in multiple little injection points over a whole area. And then sometimes we would apply that PRP topically after a laser treatment or needling treatment into the little laser wounds. PRP can also be used for hair restoration treatments, as the platelets, the growth factors, can stimulate dormant hair follicles to come back to life and improve the blood supply to the hair follicles that are there. And then we would inject it either with a syringe or with an injecting device over the scalp in multiple points down to the level of the hair follicles. Platelet-rich plasma is prepared by taking a blood sample, and then that blood is transferred into a separating vessel. There are different systems. Regen Lab uses a glass tube with a gel separator, Other systems might use a different type of vessel, but the blood is transferred into that vessel prior to being spun in a centrifuge. The spinning in the centrifuge will put the heavier, denser cells to the bottom and the lighter cells towards the top. So we get a gradient and a separation occurs. We can then draw off the fraction of that plasma that contains those platelets while leaving most of the red blood cells behind. So we end up with blood that's now got less than 1% red blood cells left in it, and where most of the cells that are in it are platelets. And these are concentrated anywhere from about 2 to 7 to 10 from 2 to 10 times, depending on the system that we're using. These are then injected back into the skin in various ways to stimulate a healing response from the body. Platelets have a life of about 3 weeks in the body. So when we inject the platelets into the body, they will then release their growth factors over a period of time in a physiological way to boost wound healing. That then causes the chemoattraction or causes other cells to be drawn to the area and then differentiate into from stem cells into collagen-producing cells, elastin-producing cells. That process goes on for several months afterwards, and probably the peak effect after a PRP treatment occurs somewhere around 3 to 6 months after the treatment. The effect of the platelets and the growth factors is but then probably sustained anywhere from 6 to 12 months after the treatment. But the collagen that's been produced does not necessarily just go away, it ages away. So to some degree, platelet-rich plasma is forestalling the aging process in the skin by re-stimulating collagen and elastin production, which then needs to be aged away. So it's not something that wears off like a dermal filler of hyaluronic acid or like like botulinum toxin in wrinkle waxing injections. It's something stimulating your own collagen that then you must age away for it to disappear.